the typical thing that happens is the documentation isn't there. So the coder's responsibility primarily is to go back and request, they call it a physician. Why don't the coders do the physician queries? It's time consuming. You have to go back, the doctors don't do it, they don't respond, and now you've held up billing for the entire chart because you're waiting for Dr. Jones to say, yes, I really did that thing. Increases. So please make sure you go to the OR for failure to document. It's a big deal. You can imagine.
But as far as if we were the person putting in the information, we would need to go through the manager and then quality.
Oh, of course, that other PowerPoint that I showed you a second ago, so that we can be on the computers too, because I think that's helpful to see. So here's the link to that website, if you can just go there. You can either pull determinations of essentially who gets Medicare coverage. And we'll go into Medicare a little bit more in later today and on Thursday. And it says these kids are really sick and they need coverage on a regular basis. We're going to provide the coverage for them so that they can get that illness within their good. And Camilla, you'll see a lot of Medicare at hospice, because that's primarily, I would say probably 100% are Medicare, because they're terminal illnesses. So if they're old enough, they're already on Medicare. If they're not old enough, then they're not. Like there might be some overlap with that, since the Affordable Care Act was based on income.
I know.
Why would we also need Medicaid?
Because I know a lot of the private insurance companies and
Under the HHS umbrellas, anything that we do as health information professionals, you'll be able to find it in hhs.gov. Because that's going to be the parent organization for any healthcare information for the entire country, or based on our government information. So Medicare would be under there, affordable.